we've missed a lot of important health activities during the pandemic. So one of those is vaccines. We've had over 37 million missed doses of vaccines during the pandemic for other conditions. So these are kids that are not going in for their well checks, and understandably, parents are afraid to take them in. And at this point, kids under 5 still can't be vaccinated. It's a little scary to take your kid into the pediatrician's office or the family doctor's office. But those vaccines are getting missed, and those kids are at risk. And the other people are at risk too who haven't been vaccinated or are immunocompromised. We've also been seeing people at higher rates of late-stage cancer because preventive screenings for cancer weren't done during the pandemic. So people weren't getting colonoscopies and mammograms at the same rates that they were before. And that's leading to people getting diagnosed later when, of course, the cancer is less treatable.
This is the Public Health Insight Podcast.
Before we move on, it is important to note that the views expressed in this podcast are our own and do not represent any of the organizations we work for or are affiliated with.
You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content. My name is Gordon, your host for this episode, along with my co-host, the one and only LaShawn Benedict. What's up, LaShawn?
Hey man, it's going well. What about you?
We're doing all right. What are we talking about in this episode?
Well, everyone's favorite topic, especially your favorite topic, we're going to be talking about insights into the COVID-19 pandemic 3 years later. Or 2 years later. Is it 2 years later?
Yeah, it feels like a while, eh?
Yeah, it feels like a while.
Yeah, so basically we have a very special guest who has been at the forefront of the COVID-19 response as it relates to immunizations and vaccinations. So we're looking to pick her brain on what should we be looking forward to as we progress through the pandemic, going past that second year since it was declared a pandemic by the World Health Organization. So is that kind of what we're talking about, LaShawn?
Yeah, exactly. And it'd be great to hear lessons learned and things we can learn from in the future for future pandemics. And, you know, some of this discussion around endemicity and when
endemicity. That's a big word.
It's a big word, but we're going to learn more about it.
Yeah. And just learn a little bit more about what we can use from the pandemic to inform creating a better world going forward.
Yeah, sounds good to me. Let's get into it.
Shall we introduce our guest?
Let's go.
Dr. Lisa Doggett is an experienced board-certified family physician and medical officer whose work focuses on improving healthcare for the most vulnerable populations. At HGS AxisPoint Health, Dr. Doggett serves as a senior medical director over the company's population health client engagements and is a leading subject matter expert in solution development. Based on her longtime commitment to promoting immunizations as a critical public health strategy and her leadership on a statewide effort to improve adherence with CDC vaccination guidelines in Texas State's supported Living Center, Dr. Doggett was recently appointed as a fellow with the American Academy of Family Physicians Vaccine Science Fellowship.
Dr. Doggett, welcome to the Public Health Insight Podcast.
Thank you so much. It's a delight to be here.
Awesome. And we're happy to have you for this discussion as well. So currently you're serving as the Senior Medical Director at HGS AxisPoint Health. And we're certainly interested in hearing more about that organization and what you do in your role in a moment. But we want to start off with your story. Tell us from the beginning where it all started, how you became interested in family medicine, and how public health kind of worked its way into that.
Well, thank you. I'm glad to share that. I'm a native Texan, 7th generation. I grew up in a family of public servants. My father's been an elected official in state politics and now in the U.S. Congress. He was elected to the state Senate 11 days after I was born and has been very, very committed to issues like affordable health insurance, equity, environmental issues, education, closing tax loopholes, a lot of really important issues, and been a real role model to me. My mom is an educator herself and an advocate for children and families. So I grew up in a family of public servants, really saw myself as wanting to follow in their footsteps. And really, when I thought about kind of career options, I felt like medicine is the most basic need that we have. A kid can't go to school if they're sick. A person can't work or have a good quality of life if their health is not intact. So it made sense for me to look at going into medicine, and then public health was a natural extension of that, wanting to do more than what I did just in the exam room with patients, but thinking about health on a broader scale. So I worked in community clinics for 13 years, and then I joined up with HGS AxisPoint Health about 6.5 years ago as senior medical director.
Wonderful. And apparently, during all that, you were working on this memoir, Up the Down Escalator, A Doctor Navigates Disease. So what is this about, and why did you feel the need to write about it?
I'm the most excited to eventually get it published, and I'm in talks with a publishing company right now. So hopefully it will be out in the near future. But it is a memoir about my own battle with multiple sclerosis, which was diagnosed when I was 36 years old, working as the director of a clinic for people without insurance, with Medicaid, Medicare, and mostly uninsured. And also I happened to have 2 kids, and they were 2 and 4 at the time. It was a very difficult period of my life. And what I realized when I was diagnosed with MS was I actually had great resources and a lot of help and good health insurance and family nearby to help me. And it was still incredibly difficult. And yet my patients were struggling with conditions often worse than MS, did not have those kinds of resources. And the inequities in our system were just more apparent to me than ever. As I discovered kind of in navigating the system for myself, and then also trying to help them with their own issues. So the book is about my journey, and hopefully it will be out in the next couple of years at the latest.
Wonderful. We look forward to that.
Yeah, we'd love to talk about that once it's out.
All right.
So if you want to join the waiting list, join the waiting list. So now we can talk about HGS AxisPoint Health. Describe the organization and your role there as a senior medical director.
I'm happy to. Yeah, HGS AxisPoint Health is what's called a care management company, a care management services company, and we focus on identifying and addressing the root causes of behaviors that worsen physical health. We're really holistic in our approach, and what this really looks like often is nurses, health coaches, social workers contacting patients who are affiliated with a certain health plan or in a state program and have been identified by us as having high risk for ending up in the hospital or having a deterioration of their health condition. We reach out to them by phone, we conduct an assessment, we ask them what matters to them, try to think beyond, again, just kind of symptoms and basic medications, but really, what drives their health behaviors, who do they have in their life that's supporting them, or who may be, what are their needs that may not be met. And we help to help to identify and then to hopefully fill in some of those gaps in their care, to improve their quality of life and their overall satisfaction with their health care.
It sounds like you're doing so much between working on this memoir, between doing your actual work, and I'm sure a bunch of other things. And then on top of that, you have this recent appointment with the American Academy of Family Physicians Vaccine Science Fellowship. Where does that fit in with all this?
Yes, that has been a really exciting opportunity for me. I'm been a longtime member of the American Academy of Family Physicians, and last year I was selected as one of 2 vaccine science fellows, which was both a good and a bad year to do it. Normally there's a lot of interesting conferences that I would have gotten to attend in person. All of that went virtual, but over this last year, the fellowship started in May of 2021. I've been involved in a number of conferences, mentoring sessions, training sessions, as well as conducting my own research project, all about vaccines. And when I talk about the good side of choosing this year to do the Vaccine Science Fellowship, I think it was certainly a year where vaccines have been talked about and more in the news and more important to us than ever before. So that made it a pretty exciting year to do the fellowship. I've still got another month, and then I'll be kind of a graduate of the program, and certainly hope to continue my work on vaccines.
Awesome. And you sort of touched on the COVID-19 pandemic, talking about the vaccine fellowship. So given that we're past that 2-year milestone of COVID-19 being declared a pandemic by the World Health Organization. I'm just curious to hear your thoughts in general about what aspects did public health and science and medicine get right so far in the COVID-19 pandemic response?
Great question. So there are some things we got right. There's a lot we got wrong, but I think some of the things we got right, initially, I think we went into lockdown mode. And, looking back, it was like, gosh, do we need to be that extreme? But we did. We didn't know what we were dealing with. And I think that those initial lockdowns, even pulling kids out of school, shutting down workplaces, as awful as that was, I think that was the right thing to do at the time because we did not know what we needed to be safe. We didn't have vaccines. We didn't even know initially if masks helped, as you all will remember. We didn't know how the virus was spread. So I think that was really important at the beginning. I think another thing that we did right is that we started to work immediately on vaccines. So that development happened very, very soon after the identification of the virus, continued rapidly, but while at the same time not cutting corners. I mean, we really stuck to all of the standard safety protocols, but we also were able to do it quickly. And then lots of different companies worked on vaccines so that we ended up having these 3 companies that emerged with very, very effective vaccines in the US. I think also making the test free and readily available for COVID has been an important step in the process. Initially, tests have always been free. Initially, we didn't have home tests, but having tests free in the community and available, we had some bottlenecks at times, but I think that was really important to encourage people to get tested so they knew how to protect themselves once we kind of knew more about that and the virus.
Yeah, absolutely. And on the other end of the spectrum, there were definitely some shortcomings or mistakes made during this pandemic response, whether it's at the country level or the global level. Can you talk a little bit about some of those mistakes or shortcomings?
Yes, the shortcomings and mistakes. Unfortunately, we weren't prepared. I think that's widely accepted as a fact at this point. We had not invested in the public health infrastructure we needed. We didn't even have personal protective equipment for physicians. My husband is a pediatrician who works in a hospital. They were short on having the right kind of masks. I have other physician friends who didn't have N95 masks that were fit well for their faces. They have smaller faces as women, and the masks were too big. There were doctors that were told to keep reusing the masks, even though they really were intended for one-time use. That was really scary. And I think that we really should have had that, stockpiles of appropriate PPE and also just other infrastructure in place. I think we also made some mistakes around messaging. So again, I mentioned the mask. Initially, we were told, oh, no, you don't need masks. Save the masks for the health professionals. We don't really need masks when we go out. And then we kind of did a complete turnaround with that and learned that masks actually were very important. But by that point, the public had lost some trust in our leaders. And it's like, well, you just told us we didn't need masks. Why are we needing them now? So I think that really hurt our efforts to combat the virus early on. And then I think our elected officials, certainly some of them were doing incredibly great, important work, but there were also many who did not set a good example. Some who still aren't. There are elected officials who are flouting our mask mandates and openly condemning vaccines. They've celebrated people who have refused to wear masks. That's just really sending a dangerous message and is contributing to people getting sick with this virus. I wanted to mention one other shortcoming, which I think continues to be a huge problem, and that is that the vaccine rollout, we've had some health equity issues in the U.S. In fact, I think the pandemic has really highlighted some of the major problems with equity in our healthcare system, where we've seen people of color dying at much higher rates than white Americans. I don't know if that's as true as much in Canada. Is that a problem in Canada as well?
Absolutely. We had an issue with not even collecting race and ethnic-based data in the first place. We could make guesses based on how other diseases unfold, but we didn't really have answers to those questions. And we still don't in many jurisdictions, actually.
I didn't
Yeah.
realize that. Yeah,
Yeah.
no, that's very unfortunate because then you don't know. I mean, you don't know what you don't know, and if you're not gathering the information, you can't learn from it and do better. So, certainly there's big health equity challenges, but I think one of the bigger challenges is the global inequities, particularly around the vaccine rollout. So at this point, we have 58% of the world's population that's been fully vaccinated, but in low-income countries, 11.5% of people have been fully vaccinated. We have an unpredictable and unreliable supply of vaccines. That's a big part of the problem. But this is really, not only is it kind of a moral, ethical concern, but it's a huge issue from a virus and pandemic standpoint because the virus can mutate and we risk having new variants emerge.
You mentioned around the science communication, public health communication piece. And I'm wondering, is there a way that we can communicate about uncertainty in science? Because I think that was the confusing part what do we say when we really don't know enough to make a conclusive statement? And then the public takes our word for it. So I don't know if you have any thoughts on how to approach uncertainty in science and how we communicate that.
That's such a good question, too. I don't think there's an easy answer there. I think that being honest, though, is really important. I know when I was doing patient care, it was scary to say that I didn't know the answer to someone's symptoms, and yet I had to do that. And I appreciate that as a patient myself when my doctor says, I'm not sure if your dizziness is due to MS or if it's due to something else. I want to know the truth. And I think that ultimately we have to trust the public to understand when we say we don't know the answer, we have some uncertainty, that we're working on it, that's true. Unfortunately, we again have lost some credibility because we've tried to sometimes guess at answers and then been wrong. And then we've had to go back and change the answer, which is confusing to everybody. So, I think it's better if we have an answer for everybody, but if we don't, and in a situation like this, we can't, I think it's much better to communicate that uncertainty up front and tell people that we're working as fast and hard as we can to get answers. Do you have thoughts about that? I'm curious.
Yeah, I'm along those same lines. I think at least what we've learned is that the mixed messaging is perhaps the most dangerous thing rather than the uncertainty itself.
Right.
So I think it's uncomfortable when, I'm not in the media every day talking about COVID-19, and perhaps it's uncomfortable to come out every day and say the same thing that you don't have information. But if you don't, then, it's best maybe not to make any guesses at that point. Whether it's the mask you mentioned, it was a whole mission to get people to trust mask again after first telling them that it's only effective if you're in a healthcare setting with body fluid and respiratory droplets.
Right.
Now it's like, oh, you have to wear it at the grocery store. And in fact, you could get fined if you don't. So it's in those situations, it's best to say, maybe more politics speak in the sense of could change at any moment and just communicate that to the public.
I would add, though, that we recently did a public health movie review on a movie called Don't Look Up, which really talked and emphasized the importance of science communication. And it led for myself, Gordon, and others to have a discussion about, is science communication and media crisis training and public speaking and risk communication, are those core courses that scientists should be taking when you're doing your PhD, when you're doing your master's, because these are the experts who are going to be portraying it to the media. And if they aren't able to communicate that in a way that they're able to speak everyone's language, so being able to communicate that in a very simple way and not too jargon heavy, right? That's a skill that should be developed. So I think that could be part of the solution.
No, that's a great point too. Yeah.
Absolutely.
Good to hear your thoughts.
This is something I assume we'll be talking about for a very long time. There's probably going to be numerous papers written on this. And I'm just excited to see what we actually learn and how we can implement it for future situations. Knock on wood.
Absolutely. I think the question of how to communicate effectively around things like vaccines when there's so much mistrust it's a really big, important question. And hopefully we're going to be able to get some answers.
And even when you start communicate it, do you communicate when a vaccine is approved and the pharmacy is waiting for people to come in? Or do you start communicating about that before the vaccines are even developed, just to warm people up to the idea? Because it seems a little bit coercive if it's like, it's out now, our mandate is to get as many people as vaccinated as possible, and why wasn't this being communicated prior to the vaccine coming out? So yeah, just curious to hear about what your thoughts were on that. And as well, those mitigation strategies that you talked about, those public health measures like lockdowns, how effective were those? And before we talk about specifically maybe each one or as a collective, how effective non-pharmaceutical interventions were, the term itself, effective, speaking of science communication, what does effective even mean? What are we really talking about when we say something is effective or not effective?
Well, I think we know so effective to me for this, when we think about the pandemic, is were the measures taken, did they help to stop spread of the virus? Did they keep people from getting sick and dying? In that sense, if they did those things, then they were effective. And what we know is that particularly in other countries, because the US really kind of had a little bit of back and forth on lockdowns, we didn't have as much enforcement, and certainly the level of lockdown that we experienced was nothing close to what some other countries have done. But what we know is that lockdowns in countries where the virus was spreading rapidly did stop the virus. Not 100%, but they really did slow the spread, and they did keep people from dying. So yes, lockdowns are effective. They're awful. They are very difficult for people. We know that one of the things we've learned is, keeping kids out of school is harmful to the kid, and in many cases not worth it now that we do know how to protect ourselves. But I think, initially having those lockdowns and some of the other safety measures that we took, like canceling events, we had to cancel the Austin South by Southwest event, which is one of the biggest music events in the US, that was supposed to happen in mid-March of 2020. It was a heart-wrenching decision for our public health officials to make the decision to shut it down, and then to also not hold it. We went virtual in 2021. But having to cancel events, conferences, meetings, travel, all of those things has been very, very difficult. But at the same time, those were, especially early on when we didn't know what was going on with this virus, those were necessary decisions. And looking back, it was like, well, of course, that was the right thing to do. It's hard, though, when you don't have all the answers and you don't know about the virus, to have to make decisions.
All right. Perfect. And I think it's time for introducing one of our newest segments on the Public Health Insight podcast. So, Dr. Doggett, are you ready for a little rapid fire?
Oh, no. I'll give it my best shot.
All right. So this is our newest segment, and we're going to call it Insight Blitz. And we'll basically be asking you questions or read some statements, and you will provide a brief response. So are you ready to begin?
Okay.
All right. Let's do it. So, if you weren't a family physician or a public health practitioner, what would you be doing for your career instead?
I would be a writer.
Oh.
Right.
I mean, I think I love to write. I've written a lot of articles. I've written this book. I'm a journal writer. I'm going to be doing some writing for a new news outlet called Public Health Watch. And anyway, I love to write.
So in line with that, name one of the most inspiring books you've read.
Oh my goodness. Well, a book I read in college that I still think stays with me is The Road Less Traveled by M. Scott Peck. It starts off with the line, "Life is difficult." And I think that especially when I was, just becoming an adult, that was a really important message for me. I had actually come from a pretty great childhood where I didn't have a lot of challenges. And as I, began to have normal adult struggles and go to medical school and residency, having that kind of line in mind, as well as a lot of the other great insights from that book, was really helpful and powerful for me.
Can you list some important traits of being a public health professional?
All right. So the traits of a public health leader, I think, really a commitment to doing the right thing for your community or whoever your sort of constituency is, and really understanding who that constituency is. So not being somebody that's isolated from it and trying to make decisions apart, but being within it and really including the people that are impacted in those decisions. I think persistence is important because to make change is always hard, and you're going to face obstacles. So really believing in what you're doing and ensuring that you keep up the struggle in the face of challenges is really critical as well.
Is COVID-19 here to stay?
Oh gosh, I hope not, but I think it may end up being something that's more like the flu. We don't know what's going to happen. It's kind of the $1 million question. Everybody's wanting to know the answer right now. I think that, frustratingly, just like with so many things with this virus, the answer is we just don't know. Some of the things are within our control. We now have vaccines. We now have testing. We know the precautions to take, but some of it isn't. And, scientists that kind of follow evolution of viruses have really recently said that it's very likely that, it's very possible, I shouldn't say likely because we don't know that yet, but it's very possible that COVID, that the coronavirus that causes COVID could become like the seasonal flu, where we see seasons that are where it comes up and there's a surge and then it calms down again and then it mutates and then we have to get a new vaccine or a seasonal booster. And then it may we may have periods where it's more virulent than other periods. So we just don't know, but it's something we certainly are going to need to keep on our radar for the foreseeable future.
Wonderful. And thank you for being a good sport about participating in our first ever Insight Blitz.
Goodness.
And I'll transition back over to Gordon now.
Well, you're not off the hook with uncertainty just yet, because we want to know from you, based on your expert judgment, if we should be worried about a new COVID-19 variant that would become dominant at some point in the future. You talked about the expected seasonality of it. Do you expect that we'll see anything at the scale of Delta in terms of severity and Omicron in terms of transmissibility? What are your thoughts on where we could end up for the rest of the year?
It's really hard to say. Such an important question too. I am optimistic, but I also am realizing that any day we may have a new Omicron emerge, a new Delta variant emerge. We have the likelihood of a new virus, a new variant emerging with mutations that make it more transmissible, just like the new Omicron subvariant BA2. There's quite a good chance that we're going to get another variant or subvariant down the road. It's possible that new variant won't be as dangerous to us. Really, the virus wants to spread. The virus doesn't want to kill people. The virus wants to spread. That's what kind of as if a virus were anything more than what it is. But I mean, the evolution of the virus is behind that is kind of the need to keep spreading to other people. And so I think that there's a reasonable chance, given how few people are vaccinated, how this virus has been shown to mutate, that we're going to end up with another version of it that is potentially dangerous, but we really just don't know.
And I read that Omicron transmissibilities between chickenpox and measles, that seems pretty high for transmissibility.
Yeah, so the Delta variant was about twice as contagious or as likely to spread as the original variant that we dealt with in early 2020. And then Omicron is a little more than 4 times as transmissible. And then Omicron BA2, that subvariant, is even a little bit more transmissible than that. Measles is even more transmissible, more contagious. That spreads really quickly and easily. It's why the vaccines for measles are so important. But yeah, we do know that this is a very contagious virus, and it's gotten more and more contagious. Again, with kind of that evolutionary drive to spread to more people, it's mutated and to be more transmissible.
You touched on it a bit earlier. It's a trade-off between maybe severity and transmissibility, where you were saying it seems like the more transmissible it is in general, the less severe it is, because the virus does not want to, in terms of a reproductive advantage, it doesn't want to kill its host, essentially. Right. Am I getting that right?
You are getting that right. In fact, I think you stated that better than I did. There's a great article in the New York Times in late March that showed really the virulence of the virus. So whether or not it kills somebody, whether or not it makes somebody really, really sick is more a matter of chance than anything else. The virus, the drive behind the virus is to spread. And actually, if the virus infects people and kills them very quickly before they can spread it to others, then the virus is not going to spread as much. So it's less likely to be a significant problem in the long run. A virus like the coronavirus that causes COVID is particularly problematic because it does make at least a sizable percentage. It's still a small percentage, but a sizable number of people get very sick, and it is very, very contagious. And so I think that it's kind of got the perfect storm here with its characteristics that's made it such a problem.
We talked about communications to the public, and one of the things I noticed was, at least in Canada, amongst a lot of politicians, was, they say, hey, after this lockdown, we'll be back to normal. Or, hey, after we get the 2 vaccinations, we'll be back to normal. Then it moves to, hey, after you get the booster shot, we'll be back to normal. So what I'm seeing is the goalpost of kind of that end goal keeps changing. And that leads me to discuss this idea of this new goalpost of endemicity locally. And once we achieve that, that's when the pandemic is over. Can you talk about what a pandemic or a virus being endemic actually means, and what does that look like in reality for us looking forward into the future?
Yeah, so when it's endemic, a virus is something that doesn't ever go away completely. It's always there, kind of lurking in the shadows, and then it comes back at times. And certainly with I think influenza virus is the one that we can relate to the most because we deal with it on a seasonal basis. And we know with flu, we know predictably that it's going to emerge usually in the late fall, and it's going to be a problem usually until the late winter, early spring, and then it usually will die down and go away for a while. Then it's going to come back in probably a little bit different form from mutations, and that's why a vaccine is so important. With the coronavirus, we just don't know what that pattern is going to look like. It could be that it's going to be seasonal like influenza. It could be that it's going to go away for years and come back, go away for weeks or months and come back. So far, it's really been interesting. It does seem to kind of be coming in waves. It seems that we in the United States and Canada too, to some extent, followed patterns from Europe. That's one of the reasons I'm concerned right now, is that we see a bit of a uptick in cases in many parts of Europe, and we're starting to see a little bit of one here. So, that's a concern. But I think that the likelihood of the virus becoming endemic, similar to flu, is certainly probably the most likely scenario. I think we all want an endpoint. It makes it so much easier to tolerate what we're having to deal with when we know at X point it's going to be better. Even if we don't know when the point is, if we have kind of the parameters set around what we need in order to have that endpoint, and yet it keeps changing, and that is very frustrating.
I agree. One of the things I've been struggling with myself is endemicity declared as the pandemic fatigue endpoint, or are there real metrics that are being used to track it? Is us as a collective society being over changing our behavior because of COVID-19 what makes it endemic, or is there a specific number that we're targeting which we should look to defining a clear endpoint?
Well, I don't know that we can define a clear endpoint. I think that's what everybody wants. I think that we have to really communicate around the fact that we don't know what's going to happen with this virus. We have a lot of really smart scientists that have experience in studying viruses that are giving us kind of some hints, but we don't really know for sure. I think we need to be really careful in our own communities to follow signs that things are getting worse. For example, there's wastewater data. We're able to track whether there's a surge that's just around the corner by looking at wastewater. And scientists and researchers look and see, are there viral particles in the wastewater? And that's a sign that we are likely starting to see more transmission of the virus. That's unfortunately happening in many parts of the U.S. right now, which has me a bit worried. There are other things that we can look at too, such as just transmission rates within a community, numbers of hospitalizations. That can be a little hard to track because a lot of people in hospitals get tested for COVID once they're there, even if they're there for another reason. So for a while, we were able to look at hospital rates when, people were going in primarily for COVID rather than being found to have COVID once they were already there. But being able to look at things like intensive care unit usage, ventilators, people with COVID who are on ventilators, those are indicators of certainly a problem when our hospitals start to get overwhelmed.
Thanks for sharing that. And one of the questions that I knew once we set up this time to talk that I had to ask you was around, immunization campaigns in general. I know this is something you've been involved with even prior to COVID-19. So I wanted to hear from you, how has COVID-19 impacted immunization efforts in terms of childhood vaccinations, adult vaccinations? What challenges has vaccine hesitancy brought up now in clinical practice? And what are healthcare providers' thoughts on kind of addressing this? Because it ultimately, a lot of it falls in the lap of healthcare providers to push immunization. So I just wanted to hear your thoughts on that in general.
Yeah, so that's a lot of different questions, and I'll try to address some of those. I think that the issue of vaccine hesitancy is certainly not a new one to physicians. We have patients who are concerned about getting vaccines or vaccinating their children for a variety of reasons. We're used to that. But the level of vaccine hesitancy that we've seen with the COVID vaccine has been unprecedented. I think it's caught us by surprise. I know, when my husband told me that he was going to be able to get a vaccine, he was one of the very first people in the country to get vaccinated as a hospital-based doctor. I was in tears. I was so relieved. And when I got my vaccine about a week later, I was also just like so excited. I felt like it was right before Christmas. I was like, this is the best Christmas gift ever because it was like, oh, I don't have to be scared all the time. And, I'm going to be able to be, not feel like my biggest fear has been passing this on to someone else. And I won't feel as worried about that. And so other physician friends were also taking pictures, posting them on social media. We were all just so excited because we didn't have to be scared anymore. And I think then to have the vaccine get rolled out and have people resisting getting vaccinated was just like, what? Are you kidding me? How could you not want to get this vaccine? This is amazing. And then I think now we've started to understand it a little bit more. And there are people that have a whole bunch of different reasons, some valid, some not at all, some, very far-fetched or based on some really dangerous misinformation. But we've started to understand that situation more. And it is very, very concerning. So it's concerning not only because we have COVID still out there in the community, but it's also concerning because, as you alluded to, it translates into more vaccine hesitancy for other things too, for other vaccines. So I just recently finished a survey of family physicians that has not been published yet, but it's looking like about a third of family doctors are concerned that people are more hesitant for other vaccines than they were prior to COVID. This is really scary. Other vaccines are incredibly important to prevent things like HPV, which is the virus that causes cancer, cervical cancer, other forms of cancer. We had already been dealing with some hesitancy for that vaccine. Flu vaccine hesitancy is a major issue. Usually only about half of people get vaccinated against flu, and that's a problem. When it translates into things like measles vaccine, we just talked about how contagious measles is. And there could be outbreaks of measles down the road if people are hesitant to get vaccinated. The list goes on because there are so many conditions that rely on vaccines to keep them from being a problem. And I'm truly concerned about that. One point that's related to this is that we've missed a lot of important health activities during the pandemic. So one of those is vaccines. We've had over 37 million missed doses of vaccines during the pandemic for other conditions. So these are kids that are not going in for their well checks, and understandably, parents are afraid to take them in. And at this point, kids under 5 still can't be vaccinated. It's a little scary to take your kid into the pediatrician's office or the family doctor's office. But those vaccines are getting missed, and those kids are at risk. And other people are at risk too who haven't been vaccinated or are immunocompromised. We've also been seeing people at higher rates of late stage cancer because preventive screenings for cancer weren't done during the pandemic. So people weren't getting colonoscopies and mammograms at the same rates that they were before. And that's leading to people getting diagnosed later when, of course, the cancer is less treatable. And then people, of course, missed visits even for heart problems or for their asthma, their chronic conditions that should have been dealt with. And unfortunately, they weren't in many cases. And now they're going to be struggling as a result of having kind of the untoward effects of a condition that wasn't optimally managed.
Yeah, that's so important that you mentioned all that, like all the different consequences of COVID-19 that aren't often shown up front. There's a lot of people who have been waiting for certain surgeries that weren't able to get them, especially in Canada. There's a huge backlog of people who've been struggling and suffering because of some of the side effects of the pandemic, if you will. I want to transition the discussion because you talked about your career, a lot of wonderful stuff, the great work that you're doing. I want to hear, with all that in mind, what was the most impactful lesson you've learned in your career thus far?
Oh my goodness, the most impactful lesson. I really think it's about persistence. So kind of our family, my family, my parents and my family growing up, our favorite slogan was never give up, never give in. And that particular kind of philosophy or drive has really been central to my whole career. So when I was doing patient care and would have a patient who was struggling with whatever it was, an addiction or had a condition that needed to be treated, but they didn't have the funds to get a test or get their treatment, I was the doctor that was, knocking on doors, calling people, asking for favors, really persisting and trying to get them what they needed. And then personally, I think that that's been important, even with my own work with HGS AxisPoint Health. We have a lot of patients that we work with who are struggling with all kinds of social determinants of health. And our philosophy has been something similar. We really want to go to bat for those people and look for community resources and work for the health plan and make sure that they get their needs met. So I think that kind of persistence and commitment to helping and serving, that's really been the most important kind of guiding principle for me.
Wonderful. I'm glad you're on the side of public health and you and your team are on our side. So that's so great to hear that you're willing to go up to bat for a bunch of people and really advocate for them. So I'm really happy to hear that. And then to kind of wrap this all up, we have a pretty wide audience who listens to this podcast, over individuals from over 140 different countries, over 3,000 different cities. And we're going to give you the moment right now to tell them, what is your take-home message for our audience?
Wow. Well, thank you for letting me have this opportunity and for listening. I think that really it's important as we've been coming out of this pandemic to really come together. I think it's been really sad to see people, especially in the United States, I know it's happened elsewhere too, to really be divided. Families are torn up because one person wants to get vaccinated and someone else doesn't, or because they have differences in terms of what their comfort level is, wearing masks or getting together for a gathering. I really would just encourage everybody to try to put those differences aside. We're all trying to navigate something that is new and scary, and we're all just trying to do the best we can. So I hope that we can all treat each other with a little bit of grace and respect differences. I struggle because I want people to get vaccinated and I want people to take care of themselves, but I do ultimately want to believe that people are coming from a good place and want to do what's right for themselves and their families.
Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.